Good evening, viewers, and welcome to this another edition of Ask Dr. Sawh, your favorite medical show. And we want to thank you. But this evening, we're doing things a little bit different. I'm actually recording from home, and Dr. Sawh, where are you? I'm seeing England don't look like that.
I'm in Cancun, Mexico. So it's a little
Cancun.
resort, a bit of a holiday
Yes.
I'm doing here for a week.
Okay.
So,
I guess this is you're still celebrating the graduation, yeah?
well, part of it, I would imagine.
Okay.
Yes,
Right.
indeed.
Actually, there's been some changes at my end too. I actually started a new job recently, and because of that, I'm more likely this is the format the show is going to be following because I won't be able to go into the studio at some of the time when it's necessary for you to, Dr. Sawh. But we are committed to you, our viewers, to bring this show to you. We're committed to that. However it has to be done, it will be done, and we are going to be bringing it to you. And this evening, I want to recognize a few persons. I know Dr. Sawh and I would like to recognize a few persons who's always been on the show. And we don't mean to be biased, but just to pick out a couple of names that we know we're always there when we're showing up with questions, and always there: Rennie P. Pat Prasad, Geeta Prasad, Natasha Lee, Kay Watson, Kesh, Sharma, you guys, and a number of other people. We're not trying to be biased, but we want to recognize all of you. Keep sending in your questions, and it means a lot to us to have this. So, Dr. Sawh, good evening. You're in Mexico. We got three questions from last week, and
Sure.
This evening our topic is shortness of breath. So, shortness of breath. I've heard that there are so many things that are related to shortness of breath, but
So,
I
of
don't.
course.
Yeah, what is shortness of breath, though?
Yeah. Well, we all know, I mean, shortness of breath, what we would say you're out of breath, but it is more of a subjective, it's usually subjective, meaning what you may describe shortness of breath may not be the same for me. However, in medical terms, we objectively can look at shortness of breath and we can quantify it or qualify it a bit. But we all know when you exercise, for instance, so there is what we call physiologic shortness of breath and pathologic shortness of breath. That is, shortness of breath can occur normally as a result of our normal body mechanism. So, for instance, if you exercise, you have shortness of breath. So you run up the stairs, you run on the treadmill. And you exercise a lot, so you should know that.
Yeah, exactly.
So that's a physiologic process. When it becomes pathologic, that is more suggestive of a disease, it is when the degree of shortness of breath is not in keeping with what is expected or what you feel is expected. So we can further say that it is anything that causes us to have an exaggerated or an effort. So we have to use an effort to breathe.
Right.
It may very well be a sensation that, okay, I am using an effort, but not actually you're using an effort, but that is some sort of discomfort where there is an effort involved and it changes the quality of the breathing. So you can have increased rate of breathing, the rhythm might be different. So those are dimensions or characteristics of shortness of breath. But for simplicity, we all know what it is. You're out of breath, you're panting for breath, and or you have an exaggerated use of effort to breathe, or labored breathing. We call it labored breathing. You're using accessory muscles, your respiration rate is increased. I mean, it doesn't necessarily have to increase to be short of breath, but the fact of the matter, most of the time it is increased and you're using effort. So I would say that's probably a simple way to describe it. But of course, there are different severity medically.
Right. That's what I want to ask you about, because I was just going to say to you, Doc, that one thing I can say about shortness of breath is that shortness of breath can be somebody like just spooking you to leading to you being going to the grave literally.
Yes.
And it may even present the same way. So what are the difference, the difference in the severity of these?
Medically, we qualify it in terms of severity, and there is different classification. There's something called the MRC, Medical Research Council classification, where they have 1 to 5 classification. So they can say, okay, somebody only get out of breath on strenuous exercise. When you do strenuous exercise, that's 1. Then you may have shortness of breath just by walking uphill. Slight incline, that is 2. Then you may have shortness of breath and walking on the level. That is 3. Then you may have shortness of breath where you can only walk about 100 yards. That is 4. And then you may have shortness of breath where you cannot do activities. You can't dress and undress. You're practically bed bound.
Yes.
And that is 5. So these are degrees of shortness of breath, and they allude to different things. So if you say, fine, I only get shortness of breath when I'm exercising, okay, that's really mild. Or I'm a level 5, I get shortness of breath when I undress or when I dress. Or I'm confined to bed, I can't do nothing. It limits your activities of daily living, we call it. So they're different. And then there is what is called the New York Heart Association classification as well. They have 1 to 4 classification. So they're different in medical terms. So the reason why I'm telling you this is that sometimes doctors, you may see your medical records or your notes, and doctor would say he is NY, HA, the New York Heart Association, level 3, shortness of breath, or MRC level 4, shortness of breath. And it tells you something medically, tell us the severity of the shortness of breath.
Right. But yes, is shortness of breath just the body gasping for air? Is it shortness of breath just the body?
No, the mechanism, well, indeed, because you're using effort to breathe, and there's a pathology behind that, of course. Your oxygen is low. So what does breathing do? Breathing, the blood transport oxygen, and breathing is where you have exchange of gas from the, the oxygenation from the air. You breathe in oxygen and you exhale carbon dioxide. So that mechanism is your breathing mechanism. So when you're getting shortness of breath, it means your body is not having enough oxygen. Put it that way. So either something is going on that is causing you not to get enough transfer of gas in your body. And our cells need oxygen to survive,
right. Yes,
to
yes.
metabolize and burn energy. And that is, what usually would cause it. But there are different causes, and we can go through that.
Yes, absolutely, yes. Because, I mean, I'm trying to break it down because shortness of breath seems to be something like everyone will suffer from that from time to time.
Absolutely,
So, but what the causes? The causes, you said there are several,
So, so let us just break it down. So we know our airway system, starting from the nose, goes down all the way to our lungs. So most people, they would associate shortness of breath to be a lung issue, but not necessarily. It could start anywhere from your nose to your lung and even out of that. So I'll just break it down for simplicity. We'll go through the stages, and then we'll know how do we decipher when someone presents with shortness of breath, what are you looking for, and how do you know where it's coming from? So if you look at the nostril, the nose, you're breathing in air from there. So if there's a blockage of your nose, you would complain of blocked nose, and you know that, okay, I'm not having enough air through my nostrils, that there's a blockage there, and that can give rise to shortness of breath. So patients with ENT problem, ear, nose, and throat problem. So if you have things like sinus congestion, some people have twisted, the inner part of their nostril is twisted. They have septal deviation. You have a cold, nasal congestion, you have hay fever, those are things that can cause nasal blockage. So look at ENT causes, right? So ear, nose, and throat causes. As you go down further, you have your airway, the larynx at the bottom there. So that's behind, at the back of the throat. You can have conditions like your epiglottis, the back of the tongue. You have, if you have an infection there, that can block it up. Bronchitis, the bronchus, these are the tubes now that lead into the lung. And then you go on to have lung disease. So diseases of the lung can be categorized in different types. So let us look simple things and common things. So infection of the lung, probably a common one. So if you have pneumonia, you can have shortness of breath as a result of pneumonia. However, infection usually will give you fever. So if we're looking at shortness of breath with another symptom, usually that will tell you what's the cause. So if I have fever, I have runny nose, I have congestion, I have difficulty breathing, it may very well be that my sinus is blocked and I'm having difficulty breathing. Or if you're having difficulty where you're not having enough air, the air is going through your nostril, but you feel that your effort in breathing, your respiration rate is going up, it could be pneumonia. Good. So lung condition. Besides pneumonia, you can have, let's say no, you don't have fever, and we're looking for things like asthma. So patients with shortness of breath, they will have wheezing, and that may tell you that it is asthma related. You know what is wheezing? Wheezing is that whistling sound. So in asthma, you're okay breathing in, but you're having difficulty breathing out. And when you're breathing out, you're exhaling, so you have a prolonged expiration. Now, you know, our body automatically, we take a breath in and we have a recoil. The lung has got a recoil system. So it recoils and the breath and the air goes
pushes out the air,
pushes out on its own. That's a involuntary process.
Absolutely.
Now, if you have that obstruction, so we call it, there's a condition called COPD, chronic obstructive pulmonary disease. So you get at patients who are smokers, they can have COPD, and they have different severity of that as well. But so asthma, COPD, pneumonia, there's something called interstitial lung disease. So that lung condition where the lung should have been like an elastic. The lung has got an elasticity, right? So it stretches and it recoils. Now, in a condition called, condition like lung fibrosis, we call it interstitial lung disease, where the lung loses, it becomes fibrotic. So it loses its elasticity. Now, that can also cause shortness of breath. So those are lung conditions. Of course, you have things like cancer of the lung. You have blood clot in the lung, pulmonary embolism. You can have a blood clot in the lung. You can have the blood vessel in the lung. You can have a high pressure. So there are different pressure. Our normal blood pressure is measured as in our vessels, the arteries, but also in the lung, it has got its own blood vessel, and you can have pulmonary hypertension, we call that. So your blood pressure can be normal, but you can have a condition where the pressure in the lung, in the blood flow in the lung itself is high, and that's called pulmonary hypertension. That can also cause shortness of breath. So we talk ENT, we talk lung conditions, and there are loads of it. Then you go on now, heart conditions. I said to you, you're getting out of breath because there's not enough oxygen going to the body.
Right.
The lung transfer the air in and out, but the heart has to take the oxygenated blood to the different parts of the body.
Yep.
So if that mechanism fails, where, okay, we have described lung already, now we have to describe all the heart conditions. Right. So every single condition of the heart almost can also cause shortness of breath. So when people talk about shortness of breath, a lot of times they always only think, or most patients probably would think, doc, something's wrong with my lungs. But no, it doesn't have to be your lungs. It could be your heart as well. So almost any condition of the heart, let's start with ischemic heart disease. So patients who've got less blood flow to the muscle of the heart itself. So like giving you heart attack. Conditions where the heart is not pumping strong enough. So the oxygenated blood comes into the heart has to pump it out. But if the pump is weak, where you have heart failure, can cause problem with the transport of oxygen. Another condition of the heart where the valves. So we know the heart has got valves, that the heart has got different sections. And you have oxygen comes in one section, and deoxygenated blood in another section, the blood without oxygen, one section of oxygen. So the heart gets chambers, right? And between these chambers, you have valves. So if the valve is damaged, you may have mixing of oxygenated and deoxygenated. So that is blood with oxygen and without oxygen. And that by itself can cause shortness of breath because the blood that is going to the body doesn't have enough oxygen. It's mixed with blood without oxygen. So these are conditions of the heart. Also conditions like if your heart rate is too slow. So your heart meant to pump at a certain
Right,
rate.
exactly. So it's not supplying fast enough.
Not
Yeah.
supplying enough. That.
Yeah.
And then also let us look at the blood system. If there is a problem with your blood, you're anemic. You remember the hemoglobin is what carry the oxygen. The oxygen is attached to the hemoglobin, the red blood cell. So let's say there's a low red blood cell, you're anemic. You don't have it cannot attach enough oxygen to it. So you have problem with oxygenation. So in breaking down shortness of breath, you have to look at all these factors that disrupt the oxygenation of the body. So the breathing and the transfer of the oxygen, be it the heart doing the transfer, as in pumping the blood, or be it the blood itself, it can cause. And besides conditions of the heart and lung, you can also have a chest wall problem. Let's say your chest is twisted. Or you have, some people get curvature, obesity, where the tummy is big, it pushes the diaphragm. So the diaphragm is the separation between the top and the bottom, your chest and your abdomen. There's a big muscle there, it's called the diaphragm. And that moves up and down. And that movement of it also helps breathing in. So that's how the diaphragm contracts, you have oxygen, it sucks in. It creates a negative intrathoracic pressure, we call it. So the oxygen is sucked into your lung, right? The air is sucked into your lungs.
That's right, yeah.
Now, if that mechanism fails, in the sense that diaphragm malfunction, and there are conditions, neurologic conditions. So people who have got, there's a nerve that supplies the muscle. Like when you're paralyzed, a normal, any condition that causes you to paralyze, the diaphragm is a muscle as well. So if that muscle is paralyzed by a nerve disruption, so there are some conditions like Guillain-Barré syndrome, myasthenia gravis, motor neuron disease. These are neurologic conditions where they affect the nerve that supply the diaphragm. So when we look at shortness of breath, we are not only looking at the lungs. We're looking at the lungs, we're looking at heart, we're looking at the whole mechanism of the chest that allow the oxygen, the diaphragm to move up and down. And then we're looking at anemia issues, as in blood issues. And there are also, importantly, I nearly forget
more
that,
things.
Psychological causes.
Yes,
people who get panic attacks.
That's right, yes.
So they would have that shortness of breath, can't breathe, but they're having a panic attack. So anxiety disorder, panic disorder. So we call that psychogenic or psychological causes. So that is in summary.
That's in summary.
Exactly.
Wow.
But there are lots to talk about, and we can then delve into each one. But the approach to patient with shortness of breath generally would be looking at, you're having a shortness of breath, and what else are you having? I'm having shortness of breath with fever. I know, there may be an infection. I'm having shortness of breath and I'm losing weight, or I'm coughing. Up blood, that will tell me it could be TB, it could be cancer. You're coughing up blood, you're losing weight. You have fever and you have shortness of breath. So when you look at shortness of breath, really, you look at what else. Or you're having shortness of breath where you're having it episodically. Today you have it, tomorrow you're okay.
Right,
next day you're having it again.
Yes.
You could say this is asthma. Or you having shortness of breath continuously. You're a smoker and you always coughing and being out of breath. It could be your lungs damaged from cigarette smoking.
Yes.
So it is about looking at it in a holistic way and understanding the process and what can go wrong.
Yeah, but I know thanks. I mean, for that lengthy that lengthy summary according to you. But here, before I go to my next question, I just want to say, man, if I seem distracted, is them jet ski go past in the back there, right? I seen them jet ski pass in the back there.
I thought it'd be nice to be in the back.
Yeah. And so I seem a little distracted. But you know what? It's ensured that I'm not short of breath, because it's keeping me fresh from just seeing that too, right? So I get to know the breath. But you've mentioned so many things about this, and there's some people that that say, man, look, man, I just climb the step, them I blow right, I reach the top, right? I blow. When what should be, because the stuff that you were listing there just now, I'm asking what are some, there has to be many emergency cases. What are some?
Sure. So when we look at emergency shortness of breath, somebody come in, they're normal, and suddenly they get out of breath. That is without, let's say, for instance, they don't have an infection and they get out of breath. It could be one of the things you need to ensure right away is that you don't have a blood clot to the lung. So you can have a swollen leg. Let's say you come back from a long haul flight and you have a leg swelling of the leg. Or without even any of that you may not know, you can throw a clot. Patients who are like women who are on contraceptive, they have high risk of blood clots formation. Patients who have got unknown cancer as well, they have a higher risk of blood clot formation. There's some people who genetically predisposed. They genetically have a disorder in their blood where they can have clot formation. So one of the important things, let's say you have sudden onset of shortness of breath without other conditions like fever, or, you know, this is not an infection, this is not pneumonia, you want to make sure you don't have pulmonary embolism. Another thing can happen that's an emergency, of course. Because pulmonary embolism, where there's a blood clot in the lung, that can be fatal. So that's an important thing. Sometimes you can also have spontaneous pneumothorax. So as I said to you, your lung is like a bag of grapes, let's say. Each grape has got oxygen, right? So you have a bunch of grapes. Your lung have got pockets like that, right?
Right.
So we call it alveoli. So
yes.
So one of those pockets can burst. Spontaneous, it bursts. The air now comes in that you're breathing in. Instead of getting, you know, confined, that then gets out. There's a sheet that covers the lung. Sorry, I'm just trying to describe it in a very simple
no, that's all right.
way that you can understand. So
No,
the
go
lung
ahead.
has got a
Yes.
sheet around it. So if air gets in between that sheet and the lung, and the air builds up as you're breathing, it's sucking in that air. So what it does, it compresses the lung.
Right.
So the tissue now, so that bag of grape, one of the grape is one grape burst, it causing that accumulation of air now in between that sheet and the lung, and it collapses the lung. Now, that's a medical emergency as well. That is called pneumothorax. And you can get that from injury. You can get that spontaneously sometimes. During exercise, you can get that. So there are medical emergencies. What else? You can have fluid. You can have a blood vessel. You can have fluid into the lung. So these are emergencies for lung conditions. But also you can have emergency shortness of breath if the heart goes into an abnormal rhythm. So sometimes your heart rate, it just started pumping fast. You've got what we call an arrhythmia. Or if your heart suddenly slows down, where you have a heart block, you can go out of breath. Because as I said to you, you have to get that, you have to have that maintained pressure in the blood to circulate the oxygen. So anything. But coming back to your question is, when do we know that this is a serious issue?
And so also, if you can add to that, Doc, while you're going through that, if you can add, yes, there are serious issues to go to the hospital. You got to go to the hospital. But are there other things also that you must look for? You shouldn't wait until it turned this bad before you go to the hospital too.
All right. Yeah. Well, of course, you want to have someone in open air. So if you are, the things you'll do first is to create an open air so you have easy flow of air. You take out restrictive clothing. So let's say you're all tight and choke, tight clothing and corset or whatever. You want to take away restrictive clothing. So it helps. But what do we look for to say this patient is really ill? He or she needs to go to the hospital, irrespective of the cause. Meaning you can have fever with any of this, and you say, fine, when do I go to the hospital? Because I'm getting out of breath and I'm having fever with that. One, we look at the respiration rate. They say a normal respiration rate for an adult is between 12 to 20. So if your respiration rate goes above 30, you should go to the hospital. It means you are having an effort, you're breathing rapidly, you're not having enough oxygen. We look at your blood pressure. So your blood pressure should be maintained. It should be top number above 90, bottom number above 60, generally. If the top number falls under 90 or the bottom number falls under 60, that's a cause to go to the hospital. Because it'll be sooner or later,
Absolutely.
it will drop, you may collapse and faint.
Yep.
If you have, so respiration rate, blood pressure, we also look at your oxygenation. So, some people measure their oxygen, they put that probe on their finger, and it tells you your saturation, we call it. If that drops under 92, you should go to the hospital. So you look at factors, things that are making you really, really unwell. If your pulse, you check in the pulse, if your pulse is greater than 130, you should go to the hospital. So it means this patient is critically ill. And of course, if anything that makes you feel that, okay, fine, I'm getting chest pain while I'm having shortness of breath, that can allude to getting a heart attack. You're getting chest pain, you're out of breath, you're sweating. You don't waste time, that is an ambulance or a hospital right away. So I think that is it in summary.
Yeah. But what investigative methods are used, to know what is causing shortness of breath?
Of course, thinking about all the causes that I've talked about, there are tons of things we can do to delineate, know exactly what is going on. So I will start with a basic blood test. Let's say somebody come in with a shortness of breath. So we're looking now if they're being out of breath for unknown cause. They don't know what is causing this. And you're being out of breath. So we want to look at hidden causes. So you would not know if you're anemic. So I may have to do a blood test to check if you're anemic. I may also want to do some breathing tests for you. So patients who have got asthma, COPD, so you may be a smoker, but you are not conscious that you're you know that you're getting more out of breath on walking uphill or walking with your friend. You say, hey, I'm out of breath, he's not. So you're comparing like for like, sort of, right? You'd want to know if the air is enough, if the lung is affected in some way. You're breathing, if the inhalation and exhalation is a problem, we have lung function tests. We call that spirometry, or you have various lung function tests we can do. Of course, you'd want to do a chest x-ray to start with. These are basic tests we start with first. So you'll have a chest x-ray to see if there's any shadowing in the lung, infection, whatever you're looking for. And then also you'd want to look at heart condition, so an ECG is important. There are tests you can do as well to know if you have a heart failure before going on to do a scan of the heart. So we can scan the heart to see if the pump is an issue or if there are valves problems, so it's called an echocardiogram. But there's a blood test called BNP. In the blood test, we can ask for a marker that is suggestive of heart failure. So a blood test can show you that. Also in a blood test, we can ask for a marker to see if you have a blood clot in the lung. There's something called D-dimer. So blood test is very important. You can look for causes. I'm looking at if you're saying this is someone with shortness of breath and they're not sure as to what is causing it, right? And then going on, you're still not sure what's going on. Then we're looking for chronic conditions now, like lung fibrosis we talked about. Then you may want to then go on to do a CT scan. That is a little bit more detail. A CT scan will give you a lot more information than a normal chest x-ray. And of course, it looks for things like tumors and, lung fibrosis and infection and everything else. So there are lots of things you can do. And in some patients, when you don't find a cause and you're looking, fine, does this patient have pulmonary hypertension? There are other probes you can put into the heart to look at the different pressures in different parts of the heart that can tell you that there is a problem with that system, heart-lung system.
Right. Doc, I'm always thinking certain things, and I'm thinking to myself, there are so many different factors that could cause shortness of breath. But yet, I think sometimes people home treat themselves, say, "Mama, get shortness of breath, drink this tablet, it's good for you." I'm thinking this treatment then should not be caused by cause.
I don't think that we should ignore shortness of breath as a symptom and say, fine, this is something trivial. We should always, our job as a doctor, I always say to patients, my job is to think of the worst case scenario and exclude it. So I would want to investigate anyone who presents with shortness of breath.
Right.
So I'd urge patients to seek medical attention if they are suffering from shortness of breath. And sometimes, yes, you may be a lack of exercise and poor tolerance, and your system is just weak, or frailty can give you shortness of breath. So as you get older and you're frail and you don't have strong muscles and all of that, it can make you get out of breath, obesity and all those conditions. So it doesn't have to necessarily be that there is a condition that you always have to find something. Sometimes
Right.
you're looking and you don't find something, but by and large, you should seek medical attention.
No, and I'm saying that it should be treatment should be based on cause also.
That's correct.
Yeah.
Yeah, of course. Well, of course, I can't tell you, okay, how do you treat shortness of breath without knowing the cause? So
Right.
we investigate, we find the cause, and depending on what you have diagnosed. So let's say, for instance, you diagnose asthma. This is the cause of your
Right.
shortness of breath, then I'll give you inhalers. If I diagnose that it's a blood clot, I'll treat that with blood thinners. If I diagnose that you have an infection, I'll treat that with antibiotics. If I diagnose that
Right.
it's a heart attack, I'll treat the heart attack, be it a stent or whatever. If it's heart failure, you may need medication to take away the fluid.
Exactly. Yes.
So
and it's necessary that people that patients understand that also, that not because a lot of times I noticed from growing up, so somebody can meet you and tell, "Buy again a shot." I remember try this tablet. Me used to get it at the drug, but then your symptoms or the cause of your shortness breath is not the same as mine, and I might be doing more harm than good. Yeah. So that's why I wanted to get in that point like that. But
how are we doing with time, Akash?
Okay, so we got 3 questions to go. That was my last question to you, actually, about cause, right? So I got 3 questions for you now, and that's it. The 3 questions.
How are we doing with time?
We're almost about time. But we just about time.
Okay,
but we got about 3 minutes more, and we're gonna do the questions.
Okay, go for it.
All right, we got time. We have about 3 minutes. So last week we were dealing with hernia, and Doc, what causes some male babies to get hydrocele?
Hydrocele. Yeah. Okay. So babies
in the womb, is that possible?
Yeah, of course. You can get it in the womb. You can get it out delivery. So the lining, I told you that the scrotum usually communicates with the abdomen, right? And that's how you have hernia. Bowel can move from the stomach, from the abdomen into the testicle, right? The scrotum. So in development, when the baby is growing in the womb, there's the lining of the abdomen. It's called the peritoneum. That cause an outpouching into the scrotum, and so you have the lining out. It bulges out into the scrotum, and then when you're somewhere just before a couple of weeks before you're delivered or after, it's meant to close. That outpouching, it forms a sac and it closes off, right? Now, if it stays open, you can have fluid from the abdomen goes into the sac, and that gives you hydrocele. So babies are born generally, you can have hydrocele at birth, or of course in the womb, it is patent. So you'll see the fluid in there. And just before, so sometimes the closure can happen anytime. Anytime from before, just a few weeks before birth to after birth, that closure should happen. And if it doesn't happen by the age of 2 years of age, then you may have to go and surgically close it.
Okay.
And that is surgical, that is infant, when they're children, babies who are born with hydrocele. But that's a developmental thing where that meant to close off after birth or just before birth.
Next question is, Doc, can hernia, or what we mentioned last week as GODI, become cancerous?
The answer is no. It can, as I say, it's a defect in the wall, weakness in the wall. Stuff pushes out from the abdomen. So it's got no relation to cancer.
All right, good. Last question is, can you say what causes cramps in the foot at nights?
All right, so that's a big one in the sense that